It's been quite tiring. It's quite heavy negotiation. Biological hazard is very important, so that would happen. There's been some battles with the employers so far about certain aspects, but I think the governments are fairly well attuned to the needs of the employers and the workers, but they tend to be looking at, I won't say siding, but looking to accommodate workers and their needs. So it's been quite useful in that respect. It's a massive issue because, as we know, in the pandemic, about 7 million people were killed, and the public health issue soon came into the workplace. Okay, so what we've gained so far is, first of all, a great win in terms of getting a convention as opposed to just recommendations, which mean there's going to be a really good standard worldwide. And some of the things that we've agreed, which are attuned to workers' needs, is first of all a wide definition of health to include mental health and well-being of workers. That was very, very important. That was a long discussion about whether biological hazards actually affect health. So got that in the convention, and for the first time ever, apart from I can remember, climate change has been included in a convention on occupational safety and health, and also a precautionary approach. Now, when I talk about that is, we know from the pandemic that was new. It was a novel virus. We didn't know much about it. It put the world into disarray, killed all of those people. And now going forward, we need a precautionary approach to look at maybe future pandemics and the preparedness, what we're going to do. And again, we've managed to get that in the convention. And also the issue of workers' finances in these sort of situations. There was a massive discussion about whether we should include all this into a convention. We managed to get some in the recommendations, some in the convention. So what I'm talking about is income protection, for example, for workers that had to self-isolate during the pandemic to make sure they had full pay. It's related to health and safety and biological hazards, because if you've got a contagious disease, you're not getting full sick pay. There's a danger you're going to go into work and give it to somebody else. So it was accepted that that was important, and also income protection while self-isolating, and also protection against redundancies based on medical issues related to illnesses. And also what is important to workers as well, which we've got into the convention, is issues around gender, differences between men and women. So there is a clause in there which covers that. However, on the disappointing side for our point of view in the UK, and I'm sure others in my group, is that I would like to see a wider equalities agenda included, not just gender. So what I'm talking about is people that are older, people with susceptibility to biological hazards, people that got other illnesses. Race was a very important part in the pandemic. So that whole equalities agenda affects this issue. Hopefully we'll get that somewhere. We haven't finished yet, so I'm hopeful we're going to get some of the other stuff that we need into the program.